avec Philip Storey du Texas qui a fait une super étude sur le pharynxéma. Bonjour Philippe.
Bonjour Sylvain.
Can you talk to me about your study?
Of course.
So
I'm Dr. Philip Storey of Austin Retina. We did a study with Roche Genentech looking at long-term outcomes in Tenaya and Lucerne. So we did a post hoc analysis of their pivotal phase 3 clinical research study looking at outcomes of faricimab in wet AMD. Of course, that study showed that the vast majority of patients could reach very long treatment intervals. About 80% of patients were able to get to every 12-week or every 16-week intervals. So what we did is we looked at that data and we said, which of these patients theoretically could have gone as long as 20 weeks? Basically, could we have gone even longer between injections? And the answer is quite a few of them. We used the exact same retreatment criteria we used in that study. So basically, the fluid had to be stable, vision had to be stable, there couldn't be any recurrent hemorrhage. And we applied that criteria to patients who had completed an entire cycle of the Q16-week dosage. We found that over 50% of patients likely could have been extended to 50 weeks. There's still about 40-45% of patients who didn't quite meet that threshold. Most commonly was due to increase in fluid, basically anatomical changes, but the majority of patients actually probably could have gone even longer than the clinical research study treated them at. We then did a subgroup analysis looking at those patients, saying what were the characteristics of patients who could have been extended. And we found that patients with less fluid, lower CST, and lower PED height were more likely to meet the criteria to be extended to that 20-week interval. So this just supports the story that Vabysmo faricimab has of increased duration, increased durability, and I think it supports those providers who choose to go even longer between injections with our patients, which is, of course is very valuable. You know, the less frequently patients have to come in, the decrease the burden of care, and the overall increased safety profile we see.
Nice. Thank you very much.
Of course, my pleasure. Thank you for having me.